Today we'll discuss about a topic known as encopresis, which most of the parents feel ashamed to bring to the notice of the doctor. So, what is encopresis, otherwise known as fecal incontinence or simply known as soiling? So, it by definition is a repetitive voluntary or involuntary passage of stool in inappropriate places in a child who is 4 years of age or older. These again have types. So, whenever there is no overt neuromuscular anorectal dysfunction, this is known as functional fecal incontinence, otherwise known as encopresis, or otherwise simply known as soiling. It's again is divided into two subtypes, which is either retentive or non-retentive. The retentive one is seen in majority of the children. It is usually associated with functional constipation, which is seen in more than 95% of the children. And to label it as a functional constipation, the child should have certain characteristic features like infrequent bowel evacuation, passing hard form stools, going into retentive posturing, and painful evacuation of a large diameter stools or feces filled rectum, thereby leading to soiling. So, any of these features, if at all if present in the child, it is said to be associated with functional constipation. So, the child usually lands up in a retentive encopresis. The other one is a non-retentive one. It is usually associated with disturbed psychosocial settings. So, where did it go wrong? To a child to land up in soiling or encopresis, it has to go wrong in either four different milestones. That is either during weaning period, that is from 6 months to 1 year, or during toilet training period, which is beyond 2 years of age, during the preschool years, which is between 3 to 5 years, and during your teenage years, where they are habituated to lot of eating disorders or eating of junk food or school stressors. There is actually a vicious cycle. So you give a child a diet which is low in fiber, which is low in fluid, which is low in whole grains, and which includes lot of processed food, and which includes more of dairy products. So the child lands up in having hard formed stool. So the child will have a painful defecation. The child withholds, and there will be stool accumulation, and further it leads to further painful defecation, and so there will be chronic fecal impaction, and the child usually lands up in soiling. So this vicious cycle needs to be broken at some part or the other. So how is the diagnosis? Usually the diagnosis is based on history and physical examination. Rarely we may do a rectal examination. High-end tests like sonography or ultrasound or large intestine contrast studies or MRI spine are usually not indicated, and it is indicated only if an organic cause is suspected. Organic causes either can be medical or surgical. Medical causes like celiac disease, hypothyroidism, and cow milk intolerance, or surgical causes like anorectal malformations, anal fissures, Hirschsprung disease, or spinal cord abnormalities. So, what is the treatment of this encopresis? The treatment of encopresis, in short, it is bowel retraining. That is, you restore the responsiveness of the colon to the stool burden. So it has different steps which are involved. First one is a disimpaction. For a disimpaction, you must give usually large enemas are required and prolonged laxative treatment is required. For laxatives, we usually give osmotic laxatives like lactulose and sorbitol, and glycerin suppositories may sometimes be used. Nowadays, polyethylene glycol is the laxative of choice because it is available in both powder as well as liquid form. And the second part is, apart from this prolonged laxative treatment, you have to start on the behavioral therapy, particularly toilet training. So, in toilet training, usually the ideal age is beyond 2 years. You have to make the child go to the washroom, sit for 20 minutes, and you have to literally show the child how to strain. So, repeatedly doing toilet training at the same time usually will lead to a good behavioral therapy, and your biological clock will be set. But you have to keep in mind the child should not be forced, and they should not evoke any anger or any punishments if at all the child fails to do toilet training properly, or if he fails to do at time, or if at all if he soils. And the last one, which is important, is your dietary change. The diet should include a balanced diet. It should include whole grains, fruits, vegetables, adequate fiber, and also fluids. And you have to decrease the milk intake because milk decreases the intestinal motility and gives a sense of satiety. Thereby, the child is further deprived of fruits and also fibers, which needs to be taken in adequate amounts. So this is the treatment of encopresis. So this is on a whole is encopresis. So parents should be kept in mind that this is not a symptom which needs to be ashamed of. It needs to be addressed at an appropriate age. We have to see where we are going wrong, and strictly no punishment or no anger on the child if at all the child soils. Thank you. We'll meet again with another topic.